Preschool parents and staff members. Thank you so much for joining on this phone call. We have Dr. Erica Fries, and she is well known here at in Mile Preschool in our community, in our tribe, and also within West Sacramento. She owns Bridges of the Minds, and she is able to provide services to children, adults, everybody of all ages. So without further ado, I would like to announce and introduce Dr. Erica Fries. Thank you so much for joining us.
Thank you for having me. It's so nice to see all these people pop on. So like Miss Jana said, I'm Dr. Erica Fries. I'm a clinical psychologist here in West Sacramento. And I am just so passionate about early intervention and talking to parents about kind of just development in general, because development is different for each kiddo. But, there are some times where we do need to start becoming just a little bit more aware of different patterns of behavior or learning styles, which might indicate something in the future, might not. But if we can kind of make preschool teachers and preschool parents aware of these behaviors and understanding of them, then we can just work better as a team to get your children support if needed. And sometimes it's just nice to kind of know what to look for, or just know that things are going okay. So I was going to do my presentation on kind of the early signs of dyslexia, ADHD, and autism. And these are all hefty topics by themselves. So I tried to make a PowerPoint presentation to kind of hit on everything as best as possible, but I could probably talk for hours about any of these one topics. So I just want to put that out there, that I'm going to save some time at the end for you to all to ask questions. And if I didn't get to something specific, please just let me know. I have my two computers open, so I'm going to try to, if you see me looking down, that's what I'm looking at. And when I have the PowerPoint presentation up, I can't see your faces, so I might be looking down to see if anybody has a question. In the middle of my presentation, though, if you have a question, please feel free to unmute yourself, and I will be happy to answer. So let me share my screen, and then I'm going to do, fingers crossed this works. Okay. So just kind of a quick overview why I feel like it's dictating what I'm saying. That's interesting. Okay, there we go. Why I feel like, I'm really passionate about these topics, but also why I understand a lot about them. I began as an ABA therapist. For those who don't know what that is, it's just a behavioral therapist for kids with autism. I began this right after I graduated college, 2003. Yeah, 2003. From there, that kind of pushed my passion to working with families and children on the spectrum and going back to grad school. So I received my postdoctoral training at Kaiser's Autism Clinic in Rancho Cordova. I was a staff psychologist at the Mind Institute for about 6.5, almost 7 years. Moved over to Dignity as a staff psychologist there, doing assessments. And then I decided to be closer to my home, and we have 3 kids of our own. So I needed just to be closer, and I wanted to build our community's resources and really share what I have with our community. And that's part of my mission in building Bridges of the Mind. So I brought it to West Sacramento, and we now have, 5 psychologists, a reading tutor. I'm about to hire a speech pathologist, and hopefully, fingers crossed, a therapist soon. So the first topic I wanted to talk about tonight is dyslexia. Usually now it's a pretty commonplace term, but there is history behind this. And I just wanted to grab this quick snapshot. And the historical understanding of it was that it was just kind of an exclusionary diagnosis. Like if you were just a kiddo who had difficulty reading, it couldn't be explained by any other cause, like a lower intelligence, visual problems, hearing problems, or just inadequate education opportunities. You were dyslexic. That was just kind of how they diagnosed it. just, from my own experience, my oldest daughter has dyslexia, which is why I'm so passionate about this diagnosis. And her third grade teacher last year said, I have never had a child in my classroom with dyslexia. And I was like, I bet you have. The understanding of it is just a little bit different, because I think the statistics now is about 1 in 5 children have dyslexia. So dyslexia today, what does it look like? And again, these are just kind of broad overviews, and I can talk so specific about each of these pieces, but it is a condition that makes reading, writing, and spelling in your native language, so your native language, for most of us it's English, difficult despite at least, oh, there is a nice spelling error, average intelligence. And the International Dyslexia Association really defines it as this neurological disorder. It's very genetic. So if you have a parent or a grandparent who said, I hate reading, I had a really hard time reading, and back then, again, it wasn't diagnosed as dyslexia, that's where you start to see the genetic piece of it. And it interferes with processing of language. So how you hear it, how you understand it, how you speak it, how you read it. And it shows up in different areas of learning. So your receptive understanding of language, your expressive understanding, and phonological processing, which is understanding kind of how sounds go together to make phonemes, and kind of goes out from there in terms of language, which impacts reading, writing, spelling, handwriting, and this says sometimes arithmetic, but I often find math being very impacted as well. So what dyslexia is absolutely not a lack of motivation. Usually these kiddos are the most motivated, especially when they're younger, because they haven't been almost impacted by their difficulty reading. They're super motivated. It's not inadequate instruction, because these kids are exposed to language early on. They're exposed to reading. It would really take a lot, basically like sitting in a four-wall room for their entire life, not being exposed to anything, to make it not dyslexia if they can't read, and not being read to enough. And I think this one is always my major pet peeve, because my oldest, again, who has dyslexia, we read to her every single night from the day she was born. And it's not our lack of parents teaching. It's just how her brain works. So not being read to enough. There is, a point where kids sometimes don't get read to enough, but that's not a cause for dyslexia. This is a lot of information. I'm kind of going to go over it quickly, because we just have a lot to get to, but these are just some basic symptoms of dyslexia in preschool and kindergarten kids. Again, it's an array. So sometimes we don't even catch it till third or fourth grade, but this is where, at preschool, where we can start hearing or understanding some of the concerns. There might be a delay in speech. There might be a mixing up of sounds, like the helicopter versus helicopter. It sounds really cute, but at some point, it is that phonemic awareness piece, or that understanding, that we need to be a little bit concerned about. Early stuttering or cluttering, kind of that mumbling language, ear infections. I would never expect a preschooler or kindergartner to, maybe kindergartner if they're like really precocious, but don't worry about the tying of shoes. But that is something later on that could be an indicator. Confusion over left versus right, or understanding like over and under those, I think, preposition concepts. They were late to establish a dominant hand, may switch pretty easily from right to left. Despite listening to stories that contain rhyming words, like they give an example of Dr. Seuss, they can't tell you what words rhyme. And this is the one that really got me when I was typing this up today, is I remember, again, my oldest, when she was 4, I would say, what rhymes with cat? And she would just look at me deer in the headlights, and she'd be like, dog? And I'm like, oh, this is interesting. Where my other 2 kiddos picked up on it super fast, and they're rhyming like crazy. And So it is interesting to kind of look back and see how some of these play a role in a later diagnosis. Difficulty learning names of letters, letter sounds, alphabet, writing the alphabet in order. So those definitely are things to be aware of. And then trouble articulating R's and L's and M's and M's and just having that immature speech all the way up until 3rd grade, when we would expect that not to be happening. So again, dyslexia is not just about reading, but it is about reading. So this first slide will talk about that, and then I'll go into the other pieces that we start to see challenging behaviors in. So one thing that they do is it's kind of this working memory piece where they can read a word on one page, and then that same word comes up on the next page, and you're like, you just read it, but you can't read it on this page. So you start to see a lot of those trends. They might be really good with phonics, but then don't use these skills that they have to sound out longer words, because they're able to understand those short, the alley alligators, but they can't use that when there's a longer word because it's just a lot of effort. They might have very slow and labored reading. Again, I would not expect a preschooler to be reading, but you start to see this in kindergarten, 1st, 2nd, 3rd grades. Lower reading comprehension, because that fluency just takes so much time and effort, they lose the comprehension piece. So again, this is something to be looking at later on. And they often substitute similar looking words. And so I gave an example that my daughter used to do. We would always in kindergarten do those sight word flashcards, and we would come up to small, and she would always say little and be so excited because the T's to her looked like the double L's, and small and little are kind of the same. But again, it wasn't just that word. You'll start to see that happening frequently. Spelling is often far worse than reading. Reading might come along a little quicker, but this is where we start to see those later-ish diagnoses like 3rd, 4th grade, because spelling is just not picking up. They have difficulty with the vowel sounds and leave them out, misspelling high frequency words such as they, what, where, does, because. Those are just examples. And sometimes their written work just shows a lot of, spelling, erasing, and spelling again, erasing. And again, sometimes this is completely developmentally normal, but if you start to see these really consistent, sorry, Miss Megan was coming in. If you start to see these really consistent, concerning.
Hold on, I want to hear this.
Hi, Miss Megan.
Hey, sorry, getting dinner ready. Sorry to interrupt.
No problem. So again, it's not just like if this is the one thing that they're doing, they have dyslexia. It's kind of these trends and patterns, which is why getting an early assessment is so important. Other considerations that we have when looking at dyslexia is handwriting, because there's a lot of dysgraphia. So the physical piece of the handwriting, quality of the written work. Again, this is a little bit above the preschool kindergarten ages, but you might have older children that you might be worried about too, or just interested in learning about how they are learning. The directionality difficulties, lefts and rights and ups and downs, and sequencing of tasks. So putting multiple steps together. They might have rote memory and non-meaningful task difficulties. So they might hold it in their memory and then completely lose it, and you can't figure out why that's happening. Difficulty telling time on a clock with hands. Extra messy bedrooms. Kids are messy, but this is like extra messy. Math difficulties, especially learning basic math facts, organizational skills in general, and sometimes there are other comorbid conditions, which I can get into more of, but I just wanted to mention it briefly. I was also going to talk just a little bit about kind of these early signs of ADHD. I honestly, clinically, don't ever diagnose it really under the age of 6 unless it's really significant, really severe, because there's really just not much treatment intervention that you can do when they're that little. It's more parent education. It's a lot of parent education up until about the age of 12, just depending on the kid and what they're presenting with. But they say that they, as in the makers of our diagnostic manual, say that symptoms can show as early as 4, but I feel clinically we need to rule out other diagnoses first. The Kennedy Krieger Institute put out this top 10 lists. And the hard thing about this is that you could probably read this and say, oh, you know, my 3-year-old has ADHD. But a lot of 3-year-olds do all of this. So I take this with a grain of salt as best as possible. But if you are concerned, I'm happy to talk a little bit more about, again, any of this in detail. So Kennedy Krieger Institute is saying that, you know, these kiddos are usually, they dislike or avoid activities that require the sustained attention for more than 1 to 2 minutes. They lose interest and start doing something after, you know, engaging in activity. So there's those kiddos who like do one thing, then move to the next thing, then move to the next thing. They might talk a lot or make a lot more noise than other children. They might climb on things when they're not supposed to. Apparently hopping on 1 foot by the age of 4 is really important. I did not know that until I wrote this up. It's just not in our clinical criteria or something that I look for, but that's something that they have noted. They might be always restless and kind of wanting to kick and jiggle and move and fidget. Even if they are seated, they want to kind of get up. They're the kiddos who might need those like wobble chairs and fidgeties in their hands. They might get into dangerous situations because of their fearlessness. So the kiddos who are just running out into, you know, the street to get their ball without thinking, or just, you know, a lot of that impulsivity. They might warm up very quickly to strangers. They might be very aggressive with playmates, not intentionally, but just a lot of that kind of like pushing and shoving or wanting to lean on them. Sometimes it does get to the extent, and this is typically why I start seeing this diagnostically, at least to do an assessment, is because they've been removed from preschool. So sometimes I get kids who have been removed from 3 to 4 preschools, and we just need to understand what's going on. This was one, has been injured or received stitches because they're just moving too fast, just going. So, but wait, so this is where I say, you know, your kiddo might fit all of that, but there's other things to consider, especially when they're so little. And this is why these early assessments are so important, because it could just be a pure speech delay, and they could just not understand that, you know, sharing something, it's harder to say, can I have that toy please, or that toy is mine, it's easier to push. Or a developmental delay where they are a year or a year and a half behind developmentally, and so their behaviors look impulsive, but they're actually on par with where they should be developmentally. Could it be trauma? And, you know, that's a really hard and sad thing to think about, but a lot of kids who have any sort of trauma in their life kind of have this impulsive type behavior. Or could it be autism? So that's why I don't like pediatricians to automatically jump to ADHD, and why it's easy to, because it's in the media, it's very a well-known diagnosis, but there's often things that underlie ADHD. So autism, what is autism? It's essentially a wide range or a spectrum, which is why we now call it the autism spectrum, a wide range of behaviors characterized by impairments in social skills, repetitive behaviors, speech, as well as nonverbal communication. And how early can we diagnose it? We can actually diagnose it as early as 12 months. I think the earliest I have done it is 12 months, and it was pretty clear. Around 18 months is where we used to like to start diagnosing. But the research has shown that the earlier we get a diagnosis, the faster we can get interventions, and the less of the behaviors continuing to be an impairment in the child's life. They just get I don't want to say better. They just learn the speech and all the other behaviors quicker with the early intervention. So autism is a spectrum, which means what you see in the media, or even like the child that you see at the store, your neighbor, they all will look different. And even if you have one child diagnosed with autism, in the other child, there's a 25% chance that we might see some behaviors on the spectrum in the other child. Those two kiddos might look completely different. So it is a spectrum and it looks different in everyone, but they do have the same underlying symptoms, which are a lot of the sensory aversions or sensory seeking behaviors, speech delays or odd uses of speech, lack of social skills, or they're overly social. Differences in play, challenges with sleep, eating, transitions, and there's much more, but they're all symptoms of autism, but they all will look different because everyone is different. So I know parents do like kind of these specific examples. So I was going to try to give a few specific examples of what each of those things look like. So for speech, you can have a kiddo who's completely nonverbal. You can have a kiddo who's just delayed in speech. I had a patient this week who's 3, and he's really good at labeling. He labels everything, but he can't say, I want a snack, or I hurt myself, or I'm cold. He doesn't use functional language, but he's amazing. His vocabulary is amazing. Echolalia is repetitive language. So it could be repeating an adult, repeating a kid. And what that will look like is if I say, do you want an apple? And they say 1 apple, or they'll just say apple. And that's their way of saying yes. Or they might repeat television shows or commercials. There's a whole bunch of examples I can give for that one, but that's basically what that one is. There's very precocious language. So these are the little guys who just sound like little professors, and they can have these amazing conversations with you, but it's just a little different than what a same age 3-year-old peer would do. And conversations. So, at 3, we should be asking, mommy, what you do today, or trying to get information out of others. What you playing with, friend? At 3, we should start seeing that emerge. And so if a child's not doing that, they're not wanting to interact socially or not wanting to share their social world with others through language, that's one thing that we do start to want to look at. We look at nonverbal communication, so gestures and how they are used. So you can be pointing, which is great, but there's sometimes kids have like stilted, they almost seem robotic when they use their gestures, or they're using gestures all over. So we do look at kind of the style and how kids use their gestures. Body language, are they leaning into people? Are they understanding personal bubbles? Are they just wanting to stay away? Are they turning themselves when they're trying to talk to you? So we do look at a lot of the nonverbal communication pieces. Social skills, in general, when I go back to talking about autism with parents who are just receiving the diagnosis, they'll say, but my child loves playing with friends. And that's like that media representation, is that we understand that with autism, you don't like playing with friends, or you don't want to interact with others. And that's just not true. These kiddos are so social sometimes, and it's almost how they interact. So are they just so social that they're not picking up on the social cues of others, and the other kids are kind of shying away from them, and they're not reading that body language? And I know that sounds very kind of higher level for the 2 to 5-year-olds, but they actually can start picking up on it even at that little. So we do look at all those pieces of social skills. Repetitive movements, hand flapping, body rocking, finger flicking, body tensing, any sort of like facial grimacing. Repetitive language goes back to the echolalia. Intense interests, this one's always a favorite of mine. This is where you ask the parents, what does he really like to play with? And you get, oh, like dinosaurs, knows every species, knows every type, lines them all up. If I move one, he gets really upset. Or, girls are just different sometimes, but sometimes it's oh, Miss Tina's joining us. There we go. Sometimes with, girls, it's especially the older ones, like anime or something about My Little Ponies or anything that seems to be kind of, they can categorize and sort, and you can learn a lot about it, is what those intense interests are. Sometimes with the itty bitty guys, it's more sensory based. So these are the little ones who, walk around with things that are just, they're flicking it and getting some sensory input from it. And so that's more of their intense interests. Difficulty with transitions, routines, transitioning from circle time to outside time might be really hard, or transitioning from cold weather to hot weather. These can be big transitions or little transitions. Specific routines that you might see them having to do, like you have to cut your apple exactly this way, else they won't eat it, or we have to drive this certain way to the store, or else we'll have a meltdown. So that's where we start to look at the rigid pieces of transitions and routines. And I put sensory aversions, but there's also sensory seeking behavior. So this is where parents say, oh, they just won't wear long sleeves, or I can't wash their hair, they'll scream bloody murder. Or they just want to touch everything and smell it and mouth it. So we look at all of those behaviors as well. Oh my gosh, that was a lot. I wanted to save enough time for questions, but if any of this sounded like you have further concerns or want to ask, something privately, just know that we're here for you. I have all my psychologists here. We have groups running. We have a reading tutor. We have just a lot of support and services, and that's my contact information and how to get a hold of me. But I would love to just answer any questions if you guys have any.
Erica, I have a question for you from a teacher standpoint. As you know, you and I have conferenced over children in the past, and in my program, it's really when we start to see these behaviors starting to surface. As a teacher, how can we best serve these parents and getting them properly referred to I guess the proper channels? I know it can be a very frustrating process for parents, and as you know, I've worked with one child like 18 months to get them a proper diagnosis, and it's such a frustrating process that I think sometimes parents end up giving up a little quick because they're just so overwhelmed by the process, or they're misled in the process. As a preschool professional, what could we do to better assist our families in the referral process?
That's always the hardest question, because I want to be as kind of direct as possible, but I feel like sometimes parents do get lost in that shuffle. For example, my little guy this week that I was talking about has been to all of those channels, and everybody who's worked with him has actually told them, no, it's not autism. And when he came in, it's very clear autism to me. And so even they're getting misled by professionals. And that's rare that happens, but it can happen. And so I always ask that we start with frontline providers, so referring to the pediatrician with specific examples. If maybe you could write a letter showing the examples, because sometimes in those quick 10-minute visits, the pediatrician doesn't get any information, and which is unfortunate.
Exactly.
Yeah.
No, and with high IQ students, we have found that they love some of the testing protocols. They'll sit there for 2 hours going through the testing.
And that's why sending them to the school district kind of gets to that same point where it's like they love the testing, and so it doesn't show those challenges that you're seeing in preschool.
So I guess what I'm hearing is kind of what we've done in the past, and I know you've been instrumental in helping us in the past with that. Basically, kind of sending parents to their primary care physicians requesting referrals with certain verbiage based on our observations. So
Yeah.
kind of some of the things that you were highlighted in your presentation, making sure that our teacher observations are reflecting that as well.
I would, and then really having a discussion with the parents that if they get shut down and there's still concerns to meet with you, and then I'm happy just to answer emails too or calls, because I really hate knowing that parents have to go through that just to try to get an answer for their kids. But I would say, if the pediatrician just kind of puts it to the side, I would ask the parent to push a little bit more for either the school district to help out or to ask for a referral for an assessment. Because clearly if you're seeing something, on a school level, there is a concern. And as a parent, I know it takes a lot as a teacher to say something. And I think that's the hardest position to be put in, is to have a teacher say something about your own child. But I know it's really important to be able to do that. And so I appreciate how you guys approach it, and how you really want to work with the families to let them know about what resources are out there. Because you are the frontline people with these little guys, and as best as we can get them interventions now, it's really only going to benefit them.
I have one more question too, and I think that this is some people on this call may also have this as a question. Is it, in your opinion, a lot of times our students are referred to speech first, and they go through that process for 6 or 8 months, and they're not seeing the improvement, meeting their goals, possibly sometimes they are meeting their goals, but at like a slower level. Is it okay to simultaneously obtain a speech referral and an ASD screening referral?
Definitely, yeah. And that's part of my passion in bringing in a speech therapist, is to do that multidisciplinary assessment. And that's how these should really be done. Parents shouldn't have to go to school and then have to find a speech therapist and an occupational therapist. Like, it should all be in one place. And so, yes, there's no detriment to that. It would only help the kid.
Fantastic. Thank you, Erica. Do we have any parents out there that have any specific questions for Dr. Freeze?
Erica, I do have a question. It's Miss Janice. And now I know in the past your organization, your services didn't offer insurance, or didn't claim insurance from parents. Now, do you accept insurance for your services?
Yeah, so we're doing Kaiser, and it's just an autism specific assessment. So parents can request that we do the assessment. It just has to go through their pediatrician, then through the autism clinic, but they can be seen by us here. And then we're doing partnership health plan, which is Yolo County's, I don't know, I think it's like Medi-Cal or something like that. It's Yolo County's partnership specific. We're doing those too. Patients have been really good about giving our super bills to their insurance companies, and most are getting reimbursed at about 50 to 70% of the total cost. So those are the two insurances that we're taking right now, and then the rest can be covered, hopefully with some reimbursement.
That's exciting that you're a Kaiser vendor. So in that situation, then could a parent request a diagnostic screening from you? So could they specifically ask for bridges of the mind?
They can. It just has to go through to the pediatrician, and that referral has to say our name in it. And then when it goes to the autism clinic, that referral has to say our name in it. That's what I've been told.
Okay.
And to be able to funnel into us.
Okay, that's good to know though. If we can direct the parents through the process and streamline it a little bit better, it just takes the elements of going back and forth for the parents, which can be so frustrating and overwhelming with everything else that they're being tasked with.
Yeah, it is frustrating. And then, Alta is always out there. We are vendors for Alta Regional Center. You do have to go through them, and you can't specifically request us through that process. But that is another way to get a free autism evaluation. Or if you're under the age of 3, it can be speech, developmental, and all of that.
Wonderful. Thank you. How about our teachers who are on this call? Do we have any teachers right now that have any specific questions? Maybe students in mind that you have a specific question on?
Erica, I have this question in mind all the time because I'm always looking for it now that we've gone through this together about dyslexia. There's only one student that I referred for dyslexia, and I think it actually it worked out. But what is the age we look for that at? Like, I know the signs, you know the signs, but it's so hard to say, right? When they're so.
I feel like it's a hindsight thing sometimes, right?
Mhm.
Where it's like,
Right.
now it makes sense why she hated letter sounds or sight words. But so I think I try to think back, like, what would I look for? We can test as early as 5.
Okay.
And so, that our assessments go down that low. And usually it's a parent who says, I had a hard time reading. Now I'm starting to see it in my child. I'm really concerned.
Genetic. Yeah.
Yeah, the genetic piece of it. But if you bring it up to the school, they're going to push it back on the family and say, wait till they're 7 or in 3rd grade, which is far too late. And we can get them such good help right away. So that one is such a tricky one.
No.
Yeah.
So pre-K, basically pre-K though, right? That's what we're.
So yeah, if you've done, your zoo phonics since Miss Danielle, and they're getting to, you or Miss Janice, and they're just not picking up on them, but everything else seems to be developmentally on track.
Yeah.
Maybe put a little bug in the parent's ear. If they're not able to at least, write or recognize their letters, that could be something rhyming, mat, cat. If that's pretty consistent where they just are not able to do it, and again, developmentally they seem appropriate, then I would be more inclined to mention something. But if developmentally they just seem delayed in all areas, then that might be more of a conversation about developmental delays.
Got it. Thank you. I appreciate that because I was afraid to refer too young for this one. It's hard.
Now, yeah, I would say 5 would be a good number to shoot for. Sometimes we could do it in 4, but it might just be a wait and see at that point.
Especially in preschool. So especially you really want to wait till the end of the pre-K year because we see developmentally all the time. The light bulbs come on that last month or two with maturation and the repetition of the years. It just, sometimes it clicks, sometimes it doesn't. But waiting till the end of, I think for sure, the pre-K year, definitely making notes of it. And if you're not seeing that progress, because it would be nice to be able to get some of these children diagnosed a lot earlier than 2nd grade when, unfortunately, right, by 3rd grade, everything is written form. They can't do math, they can't do history, they can't do social studies, science. It's so overwhelming.
Yeah, it is. It really is. And that's where some of them might start to act out and they get labeled a behavior problem as opposed to just a child who's having a hard time reading and has a learning disability. So there's so many implications negatively that will start to come about. And
or they internalize it and they have anxiety and depression.
Yeah, exactly.
No, that's really good stuff. And I think that you've given us some really good information. We by no means want to put any parents on the spot now when we know sometimes it's kind of, uncomfortable to speak up, especially in a format like this. So we will make sure that we include, Erica has this information up on the screen right now of ways that you can contact her or email her specifically. But we will also make sure that we include it in our weekly update for whatever reason you missed it. We want to make sure that you do have resources available to you. if any of our parents on this call or who, we get this recording later, our teaching staff is here for you and to put you in contact with, the resources that you feel best suit your family as well. So we're always here for you. We're a village. And just like Erica is, passionate about serving this community, so are we. And we really, really believe it's that collective effort that are going to make our children, the successes of our future. So, Erica, we thank you so, so much for your time and your knowledge and just the passion and love that you bring to West Sacramento and all of your staff. We're really excited about doing more things with you in the future as well. So is there anything that anybody else would like to add or ask before we close? All right. Thank you guys so much for joining us. And again, thank you, Erica, so much for your time and your knowledge. We appreciate it immensely.
Thank you guys for having me.
All right. Good night, everybody.
Thank you. That was wonderful.
Thanks.
No, it was